This video explains the possible mechanisms of radial motor nerve palsy we have experienced after transradial intervention. This is a fluoroscopic image of the patient's right forearm where you can see the radial and the ulnar artery converging towards the brachial artery around the elbow area. Along the radial artery, you can see a small branch called the recurrent radial artery. The yellow-colored lines show the outline of the radial nerve. The superficial radial nerve runs towards the superficial parts of the forearm and is purely sensory, whereas the posterior interosseous branch of the radial nerve runs deep into the muscles to innervate the majority of hand extensor muscles. While advancing through the radial artery, the patient complained of sharp pain in her proximal forearm area. We suspect that the guide wire may have deviated to the recurrent radial artery and caused bleeding. As we adjusted the guide wire position, the patient's pain was immediately alleviated. The recurrent radial artery originates and runs in the proximity of the branching of the superficial and posterior interosseous nerve. Let's take a magnified look at the recurrent radial artery and the adjacent structures. Posterior interosseous nerve runs through the arcade of Froese, a fibrous band between the two heads of the supinator muscle, where it innervates the hand extensors. The recurrent radial artery branches off from the radial artery and runs coaxial with the PI nerve to form the leash of Henry. These two structures, the arcade of Froese and the leash of Henry, are one of the most common sites of external PI nerve compression caused by traumatic insults to the adjoining recurrent radial artery. This may explain the radial nerve palsy manifested as complete extension palsy of the right thumb in our patient.